Welcome to Natural Health Radio. This is Dr. Teresa Dale with my co-host, the one and only Mark Alyn. And we're going to be really talking up a lot of information on health, freedom, and empowerment today. So, Mark, welcome.
Thank you. Good to be back. What do you mean health freedom? Can you explain that?
Sure. Health freedom is the ability to have it. The ability to want health freedom, meaning that you can choose anyone, any place, any method, anything you want to help yourself, meaning that you are not restricted to using just traditional medicine or just natural medicine, that it's open, that you have the health freedom as a human being to choose whatever kind of health care you want. Now, the only problem that I see with that is the insurance companies don't follow along with that.
They don't. They want you to do it their way.
Right. It's like my way or the highway.
Yeah, exactly. There are a couple of insurance companies here in California that I am aware of, at least one, that offers the following: chiropractic care and acupuncture.
Yeah, many of them do today, depending upon the state, offer chiropractic, not always acupuncture. So I'm glad that you saw that, but they're still not offering nutrition from clinical nutritionists. They're still not offering, homeopathy and nutrition, which is traditional medicine in most other countries. Most other countries, when they're sick, they do homeopathy and herbs. That's what they do.
Right. And then if it doesn't work, then they do allopathic.
So that's why allopathic medicine does not always do well in other countries, because it works. And for example, I know we discussed this before, so people may go, oh, she's talking about that again. But in India, they have 115 homeopathic hospitals, only homeopathy. No traditional medicine. And see, you can use it IV, you can use it also, you can rub it on the body, on muscles. You can also use it with suppository vaginally and rectally, okay? So homeopathy can be used in so many different ways, and in other countries, they have made homeopathy with different types of methods to be able to do that. So they will make suppositories in with homeopathic medicine in other countries. In Germany, there's so many different kinds of things, for example, that is made, which includes homeopathy from drinks to hair, skin, everything.
One of the things that I've been learning about homeopathy from you, and correct me if I'm wrong, is that homeopathy takes a little bit of something that causes the body to correct an issue. Am I wrong in that?
Well, you didn't hear that from me.
Okay.
But you heard something similar.
Okay.
So homeopathy is an infinitesimal, tiny, even more than a tiny dosage. It's a frequency that is of a certain substance. So if you start with chamomile, let's say you have a chamomile herb, they make it into a mother tincture using alcohol and water, and then they dilute that 1 drop into 99 drops of water, and they keep diluting it, and so it has, from the original substance, it has the imprint of that substance in it, the imprint, the memory of it. And it's proven that water holds memory of so many different things, right?
Sure.
So that's why water and a little bit of alcohol to hold the frequency stable is used in the manufacturing of homeopathic remedies. It's made for intramuscular, they make it IV, they make, depending upon, if you're in the United States, you can't go to this store and get intramuscular. You can't tell your regular doctor that you want an IV of Viscomalbum or Iscador, which is what they use for cancer in all other countries. Iscador.
There is, I know of a couple of infusion centers, and they'll do, I don't know if they do homeopathic or not?
It's not to be mixed with herbs or anything else. It works because it's energy medicine. It works on its own.
Okay.
So, for example, in Germany, there's the German manufacturers, the homeopathic pharmacies. I've been to many of them and toured them when I was learning. And so they make them for every disease. The only disease they can't make it for is mad cow, because you can't kill the prion. You can't kill it.
You can't kill
it, and then they would have to get rid of all their equipment, because you see what I'm saying.
Got it.
They can't quite kill it.
I haven't heard about mad cow lately. Is it still prevalent?
Well, just because it's not in the news, it doesn't mean that it's not somewhere.
That's true.
So we don't know. I think they're taking much better care than they used to with animals as they grow more into the organic area of understanding how to take care of animals that we eat. And I don't really like to eat animals for a number of different reasons, but that is the main reason, is the fact that eating animals has other, you don't know what's really in there unless it's organic.
Right. The other night I had wild-caught coho salmon from Alaska. Mm-hmm. All right. It was, first it was delicious. And we try to limit our meat intake and eat chicken and fish, and as much as possible try to get organic or natural, wild-caught, non-genetically modified everything. I hate the fact that the GMOs are sneaking in and have been for 20 years.
Well, because of Monsanto, and perhaps there are other companies that are also involved with this GMO. But our health freedom, getting back to our health freedom, it's making our society free, so that if a person needs insurance and they want insurance, that it'll cover whatever the person needs to get well. Who's dictating this here? It's the big pharma. We all know that. That's who's dictating it. So that takes away our health freedom, and we need to empower people to fight for their health freedom, so that if they choose to go to a doctor who uses mud, because this mud is special, and their friend went in it, and it cured that person, and they want to try it, and maybe it's $150, and they want to have that covered, that they can do that.
That would be very special mud. But
and it would be a lot safer than taking medications.
It would be. And there are mud baths for skin, for, I think, everything.
I think the best thing that I've ever seen, I don't mean to interrupt you, but it just came out, is for skin, is I've seen an amazing thing when I went to Optimal Health Institute, which is all raw, for a couple of weeks, and they deal with very serious, critical people who they just put them on. All they do is raw diet, drink juices, colonics, massage. And I saw a woman with psoriasis all over her body. They put her in a bathtub. I was there with most of the bathtub was filled up with straight wheatgrass juice, and the rest of it was water. So there was they were pumping out wheatgrass juice to put in here. So she soaked in that all the way up, for probably 45 minutes to an hour. And when she came out, I didn't see any psoriasis at all on her body.
Oh, my.
So that's what insurance companies could cover.
And
now, I don't know if a week later anything came back. I just know what I saw was pretty remarkable. And the ability of plants to heal our body. God makes everything we need. We don't need to synthesize anything.
And what a lot of pharmaceuticals are, you and I have talked about this, is that a lot of the pharmaceuticals are based on plants, but they synthesize it after they figure out what the active ingredient is.
Synthetic, right.
Right.
It's a synthetic. So health freedom is really about our having the empowerment to fight for having health care, any kind of health care we want, no matter what it is. And I would fight just as hard for the person who said, I know if I have the surgery that I will be totally cured. I would fight for that person to get that what they believe will help. You know what I'm saying?
It's individual.
It's individual, you know. But I do feel that if you don't try natural things, if you go right to surgery, I just think that's malpractice. I think you have to try other things. I think you try other things.
I don't disagree. I would much rather try an alternative natural remedy before, you know, having something pulled out of my body.
Right. And so if a person is sick and they say, okay, well, if you're not better in 2 months, we'll do this surgery. Well, take that 2 months and do natural therapies with them. Take that 2 months, and I'll bet you that within a week, the person starts feeling better if they're following the protocol that was custom designed for their body.
This is Natural Health Radio. Dr. Teresa Dale, I'm Mark Alyn. I want to talk to you about a new project that Dr. Dale has launched, and you're going to help me with this. This is ProWellnessPMA.com. ProWellnessPMA.com, and I have learned to read lips on the radio. What is ProWellnessPMA.com all about?
Well, after being in practice for a long time and training health providers since the year 2000, after I was in practice for, 25, 30 years at that time, I saw that how when you reach doctors and when you really reach them on a heart level, that it will really help thousands of their patients, okay? But sometimes patients are very smart and they know their body. And so I thought to myself, why don't we create something where everybody can get trained in health, in natural medicine, where anybody can learn. If they want to learn, you know how many people are passionate about healthcare? Just regular people. They go, God, I would love to help other people and help myself. Those kind of people can get training.
To become a wellness coach,
a pro wellness coach. And so they would get training via audio, video, and teleseminars and live events to do very simple things, understand the body, how it works, what the organs do, what kind of nutrition we need, what kind of diet is good, what is GMOs, why don't we want to eat them, and what about the radiation that from Fukushima, and how is it being, right today it just downloads tons of radiation into the ocean all the time. Yet nobody seems concerned about that. Nobody seems to be, you don't hear it anymore because they don't want to alarm the public, right? Well, the public should be alarmed. They should know that they shouldn't eat fish right now, from anything from the West Coast all the way up. And the polar bears up there, they have photos of them with sores on their body, ulcers on their body for the first time, that they're losing their hair, and that's because of the water.
Which has the radiation.
Yeah, that's close. So and it's going all the way down the coast. So people need to be not alarmed, fearful alarmed, but alarmed so they can make appropriate decisions for them and their family.
And if you want to be trained as a pro-wellness coach, you can go to ProWellnessPMA.com, ProWellnessPMA.com. It's very important to put that PMA in there.
It means Private Membership Association. So we are a legal private healthcare association that is registered with the federal government, and as a private association, all of us members, we get together and I train everyone, and then we network, and then we learn how to help each other.
That's ProWellnessPMA.com, ProWellnessPMA.com. We'll talk more about that in a little bit. We're talking about health freedom here on Health Radio and Natural Health Radio, and I'm really curious. Do you think that people want that choice generally, or they just go with the flow? They don't understand, they don't know.
Right. It depends on where they live in a way, and what the community is like, and what they have available to them in their community. Do they even have a health food store? And it also depends on their, genetics. How were they raised? But if they are wanting to make a change, so if they're wanting to make a change, then something will guide them to looking for natural medicine. I think there's a rise in natural medicine in the United States. I don't think that. I know that. I've seen statistics. It's been in Harvard Review. So I look at important things like Harvard to see what the latest is. And, it's all moving in the right direction. And the direction is to help humanity. So I believe that I know that if you're in a car accident, you sure don't want to come to me or anybody but go to the emergency room where you got the best people in the world to help you. Those are the kind of people.
They set the bones. They'll give you pain meds.
They save lives. They're amazing. That's
Right.
what they're trained to do. That's where you want to go if you have an emergency. But for everything else, there's work with your diet, work with just making sure that you don't, simple things, such simple things. I don't know why I thought of this, but some people have cats, right? You don't want to have them up on your kitchen counter.
No.
All right?
No.
You want to make sure everything is wiped down, with your children, and have normal sanitary opportunities in your house. You want to make sure that everything is clean.
There's something with cats, and it doesn't matter if they're outside or an inside
it's toxoplasmosis is for house cats have that. And it can
a friend of Daryl's and mine, got scratched by a cat or bit by a cat that was a house cat.
Right.
Right? It was a little tiny nothing. 3 hours later, she was on her way to the doctor because she started feeling really sick. She collapsed outside the doctor's office.
Right. So if he would have had a homeopathic remedy like I have for toxoplasmosis, it probably would have taken 3 dosage of it with no toxicity and no need for prednisone. But that's where we have a problem in this United States, that the training of our doctors does not include natural medicine.
She ended up in the hospital.
Yeah, what I'm saying is...
Yeah.
But with the homeopathic remedy, she wouldn't have ended up in the hospital. It's been used for 200 years. There's no side effects. So you're trained in your mind, and I can see that with everybody. You're trained in your mind to go to the most unnatural, most toxic thing because of the filters that we've taken on from the media and from our doctors. So most people really believe in disease. And if disease really existed, okay, then when you work on someone, let's say they have a serious health issue, they come in and they can't walk, okay, and there's something wrong with their hip. And they come in, and they go see a natural health provider for a session, and they end up walking out because they worked with their emotions.
Got it.
That is not being dealt with, and I've seen that all the time, where people come in and say, well, I was diagnosed with this. And maybe it was the wrong diagnosis, but I think a hip where a person can't walk, it's pretty simple that they have to use the cane or they have to use a walker, and when they're done, they walk. And so if that really existed, see, it doesn't. It's our emotions that holds on to things, that creates things, that blocks our neurotransmitters. There's so many different things that we in this country have to learn,
Heart disease is the number one killer in this country. Mm-hmm. So I know we've talked about homeopathy in preventing heart disease.
Well, nutrition and homeopathy and food and the emotions, according to the 5-element theory of Chinese medicine, which is 2,000 years old. It's called acupuncture. In that element of the fire element exists the heart, and the emotions related to it are guilt, trauma, and overwhelm. So those three emotions, when you have any of those three emotions that you've had since you've been a child or you're holding on to, okay, those emotions get stuck in the heart. And so you need some tools to release them and to take CoQ10 and natural things for that. You can do that easily.
If somebody has a heart attack or a stroke, okay, and they've been eating right, they it happens.
Emotions.
Yeah,
like
so
I'm
it's
saying.
emotion,
Yeah.
right. Do they go to so they have a heart attack, they're rushed to a allopathic hospital.
Right.
Okay. Should they do that to be stabilized?
Yeah, if it's
Yeah,
an emergency, yes, of course.
I mean,
it's an emergency.
right.
Yeah,
It's
any emergencies.
any emergency.
Any emergencies that come up, and an emergency would be that kind of a thing, absolutely, because they're the best at saving your life. They're the best at doing that. So,
and then as you're
doubt,
recovering, then you can...
You want to repair the body with nutrition, diet, homeopathic medicine for the heart. They make those remedies like arnica, so many different things for the heart. And we definitely want to do everything we can to heal the body and heal the heart. And the heart, of course, you have to deal with the emotions.
You mentioned before we started, disease, I guess, exists on our mind. Is that...
A lot of it does. A lot of it does. A perfect example is when you go to a doctor and they say, oh, well, you have this, and by the way, you could die from it. Okay, so this is according to the testing that they have and the labels that they have and the boxes that they put people in. So that person fits in that box. But when you look at the whole person, which is not done, and you look at the emotional issues that that person has had or whatever they have in their lifetime, and you take some of those things away, you can change the whole dynamics of that. They're not in that box anymore. So what really exists? What really exists is the human being, the heart of that person, the human being, and the emotions that go unnoticed by traditional medicine unless you go to a psychiatrist, and they don't think it can be healed without drugs sometimes, and they think it takes 20 years in therapy. And I'm sorry, nobody has 20 years or 10 years to do this.
Oh, and I believe in therapy, but I think short term.
Yeah.
A month or 2, maybe 3, depending.
I know people who have gone for 10 years.
I do too.
And stayed in that black hole because every time they go in, they're talking about the same thing and bringing it up over and over. But there are methods like neurophysical reprogramming where you can take that issue and you can collapse it so it doesn't exist anymore and the person doesn't feel it anymore and there's no charge on it anymore.
And then you're healed. I mean,
yes.
What about severe personality disorders? Severe depression. I'm trying to think of other psychopathic personalities and things like that.
It's like a lot of people that have issues with not telling the truth. And to a lot of people, and just lying about things.
Right.
And so that is a pathology as well. I mean, there's many things that you can look at that can be pathological, and that's why working on the emotions can shift that person out of that. Even, there are cases, of course, of multiple personality disorder, and, anything can be done. To say that something is incurable, I think is cruel because I don't think it's true. I think that if you only use this, and if you say putting this in there in a hole, well, that's pretty impossible just the way I'm doing it. But if you expand it to this little opening, you know what I'm saying? If you use a different modality, so they're only trained in one modality. They're trained in this.
And they should be trained in these.
Everything, yes, because that's what's going to help people. And I think there's not enough care about helping people. It's more like fitting them in the box and doing that kind of, I personally haven't been to a medical doctor in probably 35, 40 years. I go to a dentist and a chiropractor, and I figure I'm a naturopath and a clinical nutritionist, and I should be able to handle things by myself. So I do.
And look at you.
I feel good. I feel really good.
You do. You're smiling and everything.
I feel really good. I know it's sometimes when people say, and they go, "Why are you so happy?" I go, "I don't know. I just feel good. I have a good sense of humor."
This is the Happy Show.
This is the Happy Show, naturalhealthradio.com, and we're talking to Happy Mark, and we are really wanting to help you. So whatever we can do to help you, please give us a shout out. Go to naturalhealthradio.com.
Naturalhealthradio.com. And of course, the insane Daryl Wayne is controlling our buttons.
Yes.
He is, and he can't be cured though.
Well, I don't think we want to. I think the insane part of him is adorable, and he's like this hippie professor, cool guy, and he's sitting there just grooving along. So when you've reached perfection, what can you do?
That is true. That is Daryl Wayne.
That is Daryl Wayne.
Right. I want to talk to you with Dr. Dale about ProWellnessPMA.com, ProWellnessPMA.com.
It's a private
membership association. I'll get it. Private Membership Association, ProWellnessPMA.com. Tell us what a PMA is.
Well, it's the legal title of the company. That's why I use that. And it's a private association that was formed by a group of attorneys. And it's many doctors use it to make sure that when they're helping patients, they're part of the membership, especially for natural medicine. Now, we don't really use it for that. What I use it for is to train people and to train them in, teaching them about vitamins and minerals and why we need minerals and what minerals are and the importance of minerals for our body and our skin and our hair and our tissue and fascia in our body, as well as about food, cleanliness, and don't prepare your cat's food or dog's food right next to your food. I actually had someone call me and say, I was feeding my dog meat, and it was sitting next to the meat that I eat on the counter.
Oops.
And I have really bad food poisoning. I ate the wrong meat, and I'm going, listen, there's nothing that can help you. No.
Oh, that's amazing.
Yeah, so you just have to keep things organized and straight, and so we help people to help other people in simple ways, in ways of empowerment. So empowerment means that when I want to help you, that I empower you and say, Mark, honestly, I know you can do this. I know that you can help yourself, and I know that you can heal your body, and I know you're very powerful to do this. So when you tell this to someone who has been disempowered for years, a light goes back on in their eyes. And that's what we need to do. We need to bring that light to people. They're going to become a pro-wellness coach.
Right.
And they're going to help people that they know in their families and out in their community. It's not necessarily for opening up a practice. What it is, it's different. It's to bring people into the membership so they can get helped. So all the members work together to support one another, and you can help anyone you want, but it's not trying to be a doctor or anything like that. It's basically helping your friends, your family, people in your community, talking, speaking, connecting with people, and empowering people.
And teaching them, educating them about different forms of healthcare.
And that is a main form of empowerment, because when you educate, you give the people the idea that they can do it.
This is Natural Health Radio. Dr. Teresa Dale. I'm Mark Alyn. Uncle Daryl is twisting the knobs and the dials. Professorial Daryl Wayne. The idea of disease, and I guess we started to talk about this, is disease, I mean, when you look at the word, it's dis-ease. It's not being at ease with oneself.
Right.
Would that be a good description of what you're talking about?
Well, yeah, you can break it down, dis-ease, but it's, what I don't like is disempowering people with an awful diagnosis, because their immune system immediately takes a dive.
Oh.
As soon as you start feeling that you're hopeless, your immune system is going to react to that. So the way that it's done in this country, I don't like it. Although I love this country with everything. I just think it's the most amazing country in the world. We have things to learn, and one of them is about treating people with medicine. I think the people in the world that have the best idea of doing that is in England, in Germany, and Switzerland are my favorite. Those two, and France is a second, because
Italy is up there too.
They're very up there, but in France they have homeopathy in hospitals and natural medicine, and they give you a choice of whatever you would like. They want to get you better as quickly as possible because the government pays for it, so they want you out, and they are going to take care of you and use the things that they know works.
Do you think that in this country it's all related to dollars?
Of course. And that's why natural health, that's why government health care has the parts of it that aren't good, maybe for the government, and they could go broke, and I mean, there's all of that, but I don't think about that. All I think about is how much better it is for people to have, if there's government-run health care, like in Germany and Switzerland and France, there will be natural medicine in there because they want people out, and I have seen it. I've been there.
I know that one of the things that many medical doctors are doing is going to a concierge or a VIP service, and you pay a couple of $1,000s a year to be on the boards with a certain doctor, and they are at your supposedly beck and call, so that they can help treat you in case of an emergency. You have the flu, a cold, maybe even some prevention. Have you taken a look at that aspect of healthcare? It's not insurance-based.
Right, I know. And I know that it exists. And I think that's what Michael Jackson had.
Yes, I'm sure that.
I know that.
I've
studied that, and he's dead. So they'll do whatever you want.
Yes.
But sometimes that's not good either. Sometimes you need a combination of a brilliant person with a heart who will listen to you and say, well, let's think about this. If you do this, this will happen. If you do this, this will happen. You need somebody who will not, you don't pay them to do whatever you want unless you're a health provider and you're 100% certain. You want to pay somebody to have meetings with you about what you want and how to achieve that, and send them off to do their research so that you can make a decision. That would be my idea.
That makes sense to me a lot.
Go do the research on this. I want to do it this way. Let me know what you come up with.
I think we've talked about this, but if somebody comes into you and says, my left foot itches, and I've been looking on the internet.
I'd send them to you.
Oh, okay. Thank you. I don't like, but somebody says my left foot itches, and I've looked up left foot itching on the internet. Does that bother you that when a patient comes in and has brought information from the internet on, and I'm obviously being silly.
I love it. That means a person is interested and wants to get well. I have people that people that consult with me that know nothing about natural medicine really, but they're very smart and they've done genetic testing and they know what each genetic gene does because they've done all these tests. I love it because you can have a conversation a little bit deeper. So I love that. I mean, they don't have to do that, but I think it's good for everyone to do that. Go look it up. Go to the Medscape WebMD. Go to Harvard and enjoy, finding out about things.
And a lot of doctors, a lot of traditional doctors, don't like that, and I don't understand that.
Well, I can't figure out exactly what it is that why they don't like that, except if they have an ego and they don't like people getting anything but what they want them to do. I just don't know why. But I enjoy it when they take an interest and come in. What I don't like is when they come in and they'll say to me, I like you, I trust you, I'll do anything you want. And I say, never say that to anyone. Do never say that to anyone. I have to prove to you, I have to make you understand what we're going to do and why it will work, and we're going to discuss it. I don't think you should blindly trust anyone, like with your health, except if you're in an emergency, then you've got no choice, and, they're probably going to do a great job.
You used the same word in that short paragraph at least 3 times, we, suggesting that you're working with a patient as a team member.
Right.
Right?
Sure. That's the way it is.
Well,
it's
but
like
that's not the traditional way.
If Mary comes in, I'm on Mary's team, so I'm, go Mary, let's get this. And so we do it in a positive way, positive, happy, positive, you can do it way, not you're going to die. It's like, so I think that the heart needs to come back into medicine. I think doctors have a brilliant education, what they use out of that and what direction they go and how they give their power away to the big pharma. That's the other thing too. So many medical doctors that I have met, spoken to, and helped are brilliant. And they have this education. It's not a holistic approach, but what they have is really sound. And I love that because, if you just expand it out a little bit, you have the best of both worlds.
One of the things that I find is that many doctors, and especially those who, I hate to say older, aren't as open to new things.
Well, it depends what kind of doctor they are. If they're a general practitioner out in South Dakota and they're older, they probably never even use traditional medicine. They've always used country medicine. It just depends where they're from. And older, I don't know.
Interesting, huh?
Well, I think the newer doctors are, might be more open as well. It just depends, because as the world changes, as the world in the United States, our world changes with natural medicine, and it gets better PR, better media marketing from looking up things in Harvard and here and there and everything. They can read it now. Whether their mind is open to that, that's the other thing.
Well, and there's so much research, there's so much going on about even allopathic medicine and big pharma. I don't know how doctors who claim, 60, 70-hour work weeks can keep up with all the new information. Let's put homeopathy to the side. There's so many new drugs being released. I know you don't want to put it to the side. I get it. But there's so much information coming out. There's got to be some kind of brain overload to these doctors, and to add in the homeopathic
it's easy.
Information.
Basically, homeopathy, you've got medical textbooks. You can even do it online. I can tell you where to go. homeopathicinternational.org. And you've got all the doctors' medical books right there, and it's all in a database, and you put in the symptom, okay, and it spits out the remedies that are used: mind, body, spirit, emotions, mind. You know what I'm saying? So it's right there. It's right there. And they could do that and go online in a second and do it. You don't have to study for 4 or 5 years, 10 years, 3 years, 1 year. They just have to go into the homeopathicinternational.org and they put their symptoms in. They have all of the medical books in online already where you can read them right there on the internet.
Are they free?
Yep.
Whoa.
So it's all there. There is no excuse for not moving in the direction of what other countries have been doing for centuries, and it works. That's the reason why they keep it.
There's, every year there's a book that's published. I think it's the Physician's Desk Reference, right?
PDR.
The PDR. But there's a homeopathic PDR and as well, is there not?
There's homeopathic PDRs. There are medical textbooks. I have 124 of them, different ones, by different doctors that I use to study. All of that is incorporated into online homeopathicinternational.org. So, and you can read it in French, in Spanish, or in English.
Oh, my.
Yeah. So what I'm saying is it's there. People just need to go and just, it can't hurt anybody. And so you use it and you get all of the research, like what arnica has been used for 200 years, what, chamomile has been used for, what arsenicum album, which is homeopathic arsenic, made from arsenic, has been used for. Physical pain, it fixes it, just so many different things. And this is what I want to share with pro wellness coaches. I want to give people tools so they can work on themselves.
And you can learn those tools by going to prowellnesspma.com, prowellnesspma.com, to learn about becoming a pro wellness coach.
Right.
Right?
Right.
There's audio, there's video, there's text.
Teleseminars, and we're having live events where I'm going to be teaching them to do different kinds of muscle testing and understand a little bit more about their acupuncture meridians and where they are on the body, and also the body clock is so very important. It's one of the most important things.
We've never talked about that.
Most doctors that don't do acupuncture. If you do acupuncture, you know all about the body clock because that's the 5-element body clock. So at 2 o'clock in the morning is your liver time. Between 1 and 3, 2 o'clock is your liver time. So if you wake up every morning at 2 o'clock, you just seem to wake up. For maybe sometimes for no reason, maybe go to the bathroom, but that's the time you wake up consistently. Then you should really have a blood test done on your liver or do some detoxification. And this matches when people have hepatitis. This has been for 2,000 years. It's sound. So, and then you have, your heart meridian, your heart time is at noon. So if you find that you have digestive problems, maybe you eat at noon, it can be influenced in that way. So the body clock is on my website. You can get it free at wellnesscenter.net, and you can print it out. You just go to wellnesscenter.net, and then you go to resources, and you look for charts, and you'll see a tooth chart, and then you'll see the 5-element body clock chart.
Got it. And that way you can see how your body works. Does everybody's body work on the same clock?
Yes, every human being. It's acupuncture.
What about those who work opposite hours?
Right. Well, that's a really good question. So with that, it's still going to be, that's the way it is. But they can be their circadian rhythm can be very out of balance because of that. And most people who do work different hours, where
like midnight
to 5 or whatever, their circadian rhythm is going to get out of balance. Now, if they do that consistently for years, then their body is going to get a little bit used to it. But it's hard because we have daylight now. And the body knows that. The body knows what's happening. So it can create a problem.
It would seem to me a big problem. I've worked overnights in radio, And
the graveyard shift.
The graveyard shift. And it was rough on my body. It really was. More on my head. The emotions, right? You just don't know what time of day it is, no matter what.
Right. It kind of messes everything up, you know. So I would say that on this body clock, you will you'll see, you know, you'll learn about your emotions as well. So the 2 o'clock time, the liver time, according to acupuncture, is anger, frustration, resentment, rage.
AM or PM?
That is in the morning, 2 a.m. in the morning. People who can't get to sleep until a certain time, or they constantly wake up. That's what you look for overnight when they say, oh, I can't sleep. Well, what happens when you can't sleep? Well, I wake up at this time almost every day. Then you've got to work with that organ because there's a problem. Could be even bladder, could be bladder infection, could be a number of different things that you have to look at that. So body clock is the way in Germany what they teach as a traditional naturopath. That's like the main focus is using the body clock and healing and balancing the circadian rhythm, because around the clock your body makes hormones at different times of the day and night.
Right.
And when that circadian rhythm is off, then it doesn't always do that correctly.
Or make enough or makes too little. Or...
Yeah, and if you take hormones, okay, then it's going to get messed up, the circadian rhythm, because the body's used to doing that. And if all of a sudden, incoming progesterone, we're going to put this all over our body. Well, something's going to, if you do it consistently, then there's going to be a change, and not a good change. You have to heal the body so that it makes its own hormones. You have to rebuild the body, rejuvenate the body. You do this with so many different things, like medicinal mushrooms, not the magic kind, but the medicinal kind,
right.
Are phenomenal for, like cordyceps and reishi mushrooms and chaga. And these are mushrooms that help the immune system, and you want to help the immune system.
Can you eat these mushrooms? I know that they usually come dried or in capsules.
They are in powder with organic cacao and organic coconut sugar in little packets in the health food store.
Okay.
They're awesome. And so that's what I had this morning. I don't need caffeine. You do a little bit of cordyceps in the morning with some cacao and coconut sugar, you're good.
I have to try that.
Yeah.
And it keeps you not from being hungry?
Well, it doesn't keep you from being hungry. I didn't say that.
Okay.
But
it's a great way to start the day.
It's phenomenal. It's healthy for your immune system and
Gotcha.
your cortisol levels and your everything. Our time is almost up, though.
Yes, I know. And because of that, I'm going to say that if you're interested in helping humanity, you should go to Pro Wellness PMA.com. Right? Did I get that right?
You got it.
I got it. Pro Wellness PMA.com. And you can learn from our resident expert, Dr. Teresa Dale, and you can learn a wide variety of subjects, from nutrition, exercise, a variety of testing, so that you can help your family, your friends, and even people in your own neighborhood to become and stay healthy.
And at the very least, empower them to heal their body and to feel positive again. And that's the way the body heals. You can't heal it when you're in the dumps, when you're depressed. It's not going to happen. It's going to happen when you can lift the energy and feel like, okay, I'm going to fix this. Okay, and I think faith is very important. People who say, well, I don't have faith, there's no proof of God or anything. I think I've seen a lot of unhappy people who feel this, okay? And I think investigating that a little bit more and being open to joining other people, networking with other people, to see what other people experience.
And that's what Pro Wellness PMA markalyn.com.
We want to thank you so very much, and we love helping you. So please connect with us if you should ever have any comments, questions, or if there's anything that you would like to hear us talk about. Thank you, Mark, so much.
Thank you.
Thank you. Okay. See you next time. Bye.
Thanks, Daryl.